let's talk about that last piece. Really important to me, hormonal health. Went through menopause at 39. If it wasn't for the help of Dr. Christy Prouse, OBGYN, functional medicine doctor, and a specialist in hormones, I know that my REMs would look very differently. So can you speak to hormones? What about the young girl or boy that has an eating disorder and they never reach peak bone mass? Or what about thyroid hormone? Can we talk about the overall role that hormones play in our musculoskeletal health?
So let's just start as a young adult, and then we'll work our way into peri and postmenopause. As a young adult, there are research studies looking at women who don't cycle regularly. And this is unfortunately extremely common, right? So dysfunctional cycles, ovulatory defects, women that aren't ovulating, they're having irregular cycles, or they're on birth control and they're not cycling at all, right? So like all these things happen. So we know based on the literature that if a woman isn't having that normal push-pull of rise in estrogen, fall in estrogen, rise in progesterone, fall in progesterone every month, if that isn't happening on a regular basis, she's losing bone. So even for women that have normal estrogen levels, but dysfunctional progesterone levels for whatever reason, we know that they're losing bone. So we know that the natural rhythm, the push-pull of estrogen and progesterone is critical to bone health. It's true in women from a cyclic perspective. In men, it's also true, but it's a little more steady state, right? So men's testosterone levels, they're going to aromatize into estrogen, and that estrogen helps support our bone and cardiovascular and brain health. So as women get into perimenopause, when especially estrogen levels start dipping, progesterone may actually not be getting driven up, ovulation defects again, issues with the cycle, we're going to start losing bone. This is why we should at least be screening women right at menopause or 10 years before, preferably, and throughout that perimenopause timeframe, because we know that they're going to start losing bone.